Fluorescent lights don't just buzz, they grind. They chew through your retinas on hour 11. Bridget inhaled the scent of stale vomit and industrial sanitizer, ignoring the muffled giggles from the nurse's station. They thought she was incompetent. They didn't know she was just trying to forget the sand. The Pyxis machine was a glorified vending machine for narcotics, and it hated Bridget's right thumb. She stood in the narrow medication room, jabbing her digit against the green glowing glass of the biometric scanner. "Access denied. Please try again." The machine let out a soft, flat electronic chime that felt distinctly mocking. Bridget wiped her thumb on her scrubbed, stiff, boxy fabric that smelled faintly of commercial bleach and iron and pressed down again. "Access denied." "You have to press gently, Bridget," a voice sighed from the doorway. Bridget didn't turn around. She knew the voice. Diane, the charge nurse. Diane wore cartoon character scrub tops, sensible orthopedic clogs, and carried a clipboard like a broadsword. She had been a civilian ER nurse for 20 years and treated anyone with less tenure like a slightly deaf toddler. "It's a scanner," Diane continued, stepping into the room and nudging Bridget aside with a patronizing bump of her hip. "Not a detonator. You don't need to muscle it." Diane pressed her perfectly manicured finger to the glass. The drawer clicked open instantly, sliding out to offer a vial of Dilaudid. "See," Diane said, handing the vial to Bridget. "Finesse, you're too rigid. This isn't a boot camp, sweetie. It's an ER. You need to soften up." Bridget took the vial. She didn't point out that her thumb didn't work because the friction ridges had been melted off by a piece of superheated shrapnel outside of Kandahar. She just nodded her jaw tight, staring at the linoleum floor. "Thanks, Diane." As Bridget walked back out to the main floor, she heard Diane whisper to Ashley, one of the fresh out of nursing school hires. "I don't know who pushed her through HR," Diane murmured, not quite quietly enough. "She's so slow. Took her 20 minutes to figure out the Epic charting system yesterday. And her bedside manner, Jesus. She told the guy in bed 4 to stop whining about his stitches because his leg was still attached." Ashley giggled, a sharp nasal sound that cut right through the low hum of the cardiac monitors. "She asked me where we kept the tourniquets yesterday, and when I handed her the blue rubber band, she looked at me like I handed her a wet noodle. Like, what else would we use?" Bridget kept walking. She didn't let her shoulders drop. She didn't let her pace quicken. She just pushed the squeaking IV pole down the hallway toward room 6. This was civilian medicine. A world of drop-down menus, customer satisfaction surveys, and pain scales with little smiling and frowning faces. Bridget was drowning in it. For 8 years, she had been a Navy hospital corpsman. She knew how to pack a shattered pelvis in the pitch black of a medevac chopper. She knew the exact smell of a tension pneumothorax. She knew how to keep 3 Marines alive with nothing but a trauma bag and sheer screaming willpower. But here in Oak Ridge, Memorial, she was an idiot. She was the weird, silent woman in her late 20s who couldn't remember the billing codes for a simple laceration. She was the charity hire the veteran initiative checkbox that management liked to brag about on LinkedIn. She pushed open the curtain to room 6. The patient, a middle-aged man with a kidney stone, was groaning loudly. "I have your pain medication," Bridget said, her voice flat, devoid of the sickly sweet customer service lilt that Diane demanded. She uncapped the IV port, flushed it, and pushed the Dilaudid. "About time," the man gritted out, glaring at her. "I've been hitting the call button for 10 minutes. You people are useless." 10 minutes is a long time, Bridget agreed neutrally. "The medication will hit your system in about 30 seconds. Try to breathe through it." She didn't apologize. She couldn't bring herself to do it. Apologizing meant someone had done something wrong, and Bridget had prioritized an active myocardial infarction in room 2 over this man's kidney stone. In triage, air beats blood, and blood beats rocks. Simple math. But in Oak Ridge, math didn't matter. Feelings did. She walked back to the nurse's station to chart the medication. Sitting down at the computer, she stared at the screen. The interface was a nightmare of tabs, subtabs, and mandatory fields. Patient spiritual needs, dietary preferences. She aggressively clicked through her scarred hands, clumsy on the plastic mouse. Dr. Hayes, a second-year attending, who looked like he spent more time on his hair than his medical journals, leaned over the counter. "Bridget, did you update the whiteboards in your rooms?" he asked, sipping from a Yeti tumbler. "No, doctor," Bridget said, eyes on the screen. "I was pushing meds." "Right. Well, the whiteboards are important. It helps the patients feel connected to their care team." He tapped his pen against the desk. "Also, when you write your notes, try to be a bit more descriptive. You wrote, patient bleeding controlled, vitals stable. Write about the wound margins. Write about the patient's emotional state." Bridget stopped typing. She looked up at Hayes. She felt a familiar dark knot tightening in her stomach. A mixture of rage and profound soul-crushing exhaustion. She wanted to grab him by the lapels of his pristine white coat and scream that if a patient is bleeding, the only thing that matters is making it stop. You don't ask the wound how it feels. Instead, she blinked. "Understood, Dr. Hayes. I'll update the whiteboards." She stood up. Behind her, she heard Ashley snicker again. "Robot." Ashley coughed into her hand. Bridget walked away, retreating toward the supply closet. She stepped inside, pulling the heavy wooden door shut behind her, plunging herself into the dim light and the heavy smell of sterile gauze and cardboard boxes. She leaned her back against the door and slid down until she hit the floor. She pulled her knees to her chest. She wasn't a hero. She didn't want to be one. She just wanted a job that paid the rent, a job where she could quietly do her time. Go home to her empty apartment, feed her cat, and drink a glass of cheap whiskey until the static in her brain stopped. But the sheer suffocating uselessness she felt here was breaking her. She looked at her hands in the dim light. Calloused. Scarred. Useless for typing. Useless for smiling. Maybe they're right, she thought, closing her eyes. Maybe I don't belong here. The shift turned at 2 p.m. The afternoon lull settled over the ER. The waiting room was full of sprained ankles, coughs, and vague abdominal pains, but the trauma bays were empty. Bridget was meticulously restocking IV tubing in bay, when enjoying the quiet mechanical repetition of the task. Snap the plastic wrapping, stack the tube, repeat. Then the red phone rang. It wasn't the standard digital trill of the hospital lines. It was a harsh physical bell. The EMS dispatch line. Out at the main desk, Diane picked it up. Bridget could see her through the glass doors of the bay. Diane's posture was relaxed, a bored expression on her face as she put the receiver to her ear. "Oak Ridge ER charge nurse," Diane said. A pause. Bridget watched Diane's expression shift. The boredom vanished, replaced instantly by a sharp, rigid panic. The color drained from her cheeks, leaving her looking suddenly her age. "Wait, slow down," Diane said, her voice rising an octave, piercing through the ambient noise of the ER. "You can't divert here. Harborview is a level 1 trauma center. We are a level 3. We don't have a cardiothoracic surgeon on call." Dr. Hayes looked up from his chart. The younger nurses, Ashley and Chloe, stopped gossiping. The air in the ER seemed to thicken the way it does right before a thunderstorm breaks. "I don't care about the weather," Diane practically shouted into the phone. "We don't have the massive transfusion protocol ready for that kind of injury. You need to reroute." Diane slammed her hand on the console, hitting the speakerphone button. The ER filled with the sound of heavy rhythmic static. Thwack, 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 thwack. It wasn't an ambulance siren. It was the heavy concussive beat of helicopter rotors, and it sounded frantic. A voice cut through the static, distorted, but hard with adrenaline. "Oak Ridge, this is Coast Guard Rescue 4 Tango. Harborview's pad is socked in with zero visibility. We are running on fumes, and our patient is crashing. We are 3 minutes out, landing on your roof. Clear the pad." Dr. Hayes dropped his pen. "A chopper. Our helipad hasn't been certified in 2 years. The freight elevator is slow." "Rescue 4 Tango." Diane stammered toward the speakerphone, her hands shaking. "Patient condition. Give me patient condition." 24-year-old male, the voice crackled. "Deckhand, caught in a commercial winch cable. Partial amputation of the right lower extremity. Massive crush injury to the chest. We've got 2 tourniquets on the leg, but they're slipping. He's tachy at 140 pressure, is 70 over palp. We are losing him." Hayes looked at Diane, his eyes wide. "He's bleeding out. We don't have O negative on the floor. It's all down in the blood bank. And if his chest is crushed—" "I can't authorize this," Diane yelled at the phone. "You are bringing a corpse to our roof." The radio crackled again. The pilot's voice was tight-strained to the breaking point. "Oak Ridge, listen to me. I have a Navy SAR medic in the back doing everything he can, but we are out of hands and out of time. Is Bridget there?" The ER went dead silent. Even the machines seemed to quiet down. Diane stared at the phone. "What? Is Bridget Sullivan there?" the pilot yelled over the rotors. "Call sign Stitch. The manifest said she works at Oak Ridge now. Get her on the radio, now." Bridget stood in Bay 1. She felt a cold sweat prickle the back of her neck. Her stomach dropped into an icy, familiar abyss. Stitch. Nobody had called her that since the dust-off in Helmand. She walked out of the bay. Her footsteps were heavy, deliberate. The squeaking rubber of her shoes was the only sound in the room. Diane Hayes Ashley. They all turned to look at her as she approached the desk. They looked at her as if she were a stranger who had just wandered in off the street. Bridget didn't look at them. She kept her eyes on the black plastic console of the radio. She reached out. Her hand didn't shake. The clumsiness that plagued her with the Pixis machine, the awkwardness she felt typing on the computer, it evaporated. She pressed the mic button. Her thumb, slick with old burn scars, gripped the plastic hard. "This is Sullivan," she said. Her voice wasn't flat anymore. It was a gravelly low baritone that cut through the room like a serrated edge. "Bridget, thank God." The voice on the radio changed. It was still panicked, but there was a sudden desperate relief in it. "It's Miller, Marcus Miller. I'm flying right seat." Bridget closed her eyes for a fraction of a second. Miller. He had flown medevacs out of Camp Bastion. "Talk to me, Miller," Bridget said. "Kid's bleeding through the TQ," Miller yelled over the engine whine. "Femoral artery is retracted. We can't clamp it in this turbulence. Chest is asymmetrical. Diminished breath sounds on the right. He's suffocating on his own blood, Bridget." Bridget's mind snapped into a terrifying crystalline focus. The bureaucracy of Oak Ridge melted away. She wasn't an ER nurse worrying about customer satisfaction anymore. She was HM1 Sullivan. "He's got attention pneumo," Bridget barked into the mic. Miller, tell your medic to needle decompress the right chest cavity. Second intercostal space mid-clavicular line. Use a 14 gauge. He tried, Miller shouted. Needle kinked. The kid's chest wall is too thick, muscles spasming. Then he needs a finger thoracostomy. Bridget said, her eyes tracing the ceiling as she visualized the anatomy. Tell him to cut. Fifth intercostal mid-axillary. Blunt dissect with a hemostat, shove his finger in, and clear the pleura. Do it now, or he dies before you touch down. Dr. Hayes stepped forward, his face pale. Bridget, you can't authorize a surgical procedure over the radio. We have protocols. Bridget turned to Hayes. The look in her eyes was so intensely violent, so entirely devoid of the meekness she had shown for the past month, that Hayes physically took a step back. Shut up, Bridget said softly. She turned back to the radio. Miller ETA. 60 seconds. We are directly overhead. The heavy thwack, thwack, thwack suddenly grew deafening. The thick glass doors of the ER began to rattle in their aluminum frames. The dust on the acoustic ceiling tiles vibrated, raining down in fine white particles. Bridget dropped the radio mic. She turned to the stunned staff. Diane, Bridget snapped, call the blood bank. I need 6 units of O-4 of plasma right now. Tell them to run it up the stairs if they have to. Ashley, get the massive transfusion infuser and prime it. Ashley stood frozen, her mouth open. I don't know where the tubing is for that. Move! Bridget roared a sound that tore from her chest, echoing off the linoleum. Find it or get out of my way. She looked at Dr. Hayes. He was staring at the ceiling as the heavy concussive downdraft of the helicopter rattled the entire building. Hayes, Bridget said, her tone dropping back to that icy, terrifying calm. Grab a rapid infuser, a chest tube tray, and 3 combat application tourniquets. Meet me at the freight elevator. We aren't a trauma center, Hayes stammered. We can't. We are today, Bridget said. She didn't wait for his response. She spun on her heel and broke into a sprint down the corridor toward the elevator banks, the sound of the chopper tearing the roof apart above them. Metal ground against metal as the freight elevator hauled them upward. The cab smelled of old floor wax and ozone. Beside Bridget, Dr. Hayes stood clutching a sterile plastic tray of chest tubes, like a waiter holding a tray of doomed champagne. His knuckles were bone white. He was staring at the steel doors, his jaw working as if he were trying to swallow a golf ball. I've never done a thoracostomy outside of a sterile operating room, Hayes said, his voice remarkably small. You aren't doing it now either, Bridget replied, her eyes fixed on the floor indicator panel. You're going to hold the meat. When I tell you to push, you push. If you let up for even a second, he bleeds out. Do you understand? Hayes swallowed hard and nodded. The elevator lurched to a halt at the roof access level. The doors slid open and a wall of noise and physical pressure hit them. The Coast Guard Jayhawk helicopter was already on the cracked concrete of the disused pad, its massive rotors beating the air into a violent, deafening submission. The downdraft was a physical assault, throwing loose grit and old roofing gravel into their faces. The air tasted of burned kerosene, the harsh metallic tang of JP-5 aviation fuel, and the damp chill of the approaching storm. Bridget didn't hesitate. She ducked her head against the rotor wash and ran toward the open sliding door of the chopper. Hayes followed, slipping slightly on the grit, his pristine white coat whipping around his legs. Inside the cabin, it was a slaughterhouse. The deck plates were slick with a horrifying amount of cherry red blood. It pooled in the corrugated grooves of the metal flooring. Kneeling in the center of the chaos was the SAR medic, A young guy named Gomez, his uniform soaked through to the chest. He was fighting a losing battle against a torn human body. "Stitch!" Gomez yelled over the turbine whine as Bridget vaulted into the cabin. He didn't question her presence. In this specific blood-soaked corner of the universe, rank and titles didn't exist. Only competence mattered. Bridget dropped to her knees beside the patient. He was a kid, maybe 22. His skin was the color of wet concrete, slick with cold sweat. His eyes were rolled back, his lips tinted a dusky, dangerous blue. He was drawing in ragged, gasping breaths that didn't seem to move any air. "Leg first!" Bridget yelled, sliding into the slick mess on the floor. The winch cable had sheared through the meat of his right thigh. 2 black combat tourniquets were ratcheted down on the limb, but they were failing. The sheer volume of blood and the slickness of the severed adipose tissue were causing the nylon bands to slide down the tapering cone of his leg. The femoral artery was still pumping a steady, weak rhythm of arterial blood onto the deck. Bridget grabbed Hayes by the collar of his scrubs and yanked him into the cabin. "Here!" she barked, pointing to the groin crease just above the mangled flesh. Put your fist right here and put your entire body weight onto it." Hayes fell to his knees, his eyes wide with horror as he looked at the ruined limb. He hesitated. "Do it," Bridget roared. Hayes slammed his interlocked fists into the kid's groin. Bridget grabbed his shoulders and forced him downward, locking his elbows. "Do not move. Do not breathe. You are a clamp now." With the bleeding temporarily pinned, Bridget spun toward the chest. Gomez had attempted the finger thoracostomy, but the incision was too low, the muscle wall too thick. The trapped air from the crushed lung was crushing the heart, preventing it from pumping whatever blood the kid had left. "Tube tray," Bridget demanded, holding out a hand. Gomez ripped the plastic wrapping off the tray Hayes had dropped. Bridget didn't bother with local anesthetic. There was no time, and the patient was practically unconscious anyway. She grabbed a number 10 scalpel. She felt for the 5th intercostal space, the gap between the ribs just under the armpit. She pressed her thumb hard against the skin, finding the bony landmarks, and drove the blade in. She sliced through the skin and intercostal muscle. A thick bubble of dark blood breached the wound. She dropped the scalpel, shoved her index finger directly into the hot, rubbery slit, and pushed through the pleura. The texture of the inside of a human chest cavity is something you never forget. It's tight hot and violently slick. Bridget felt the spongy, deflated tissue of the lung scrape against her knuckle. "Tube!" she yelled. Gomez slapped the thick plastic chest tube into her palm. Using her finger as a guide, Bridget slid the stiff plastic into the hole, angling it upward and backward. The moment the tube cleared the chest wall, she grabbed a heavy Kelly clamp and secured it. Shh! A massive wet rush of trapped air and dark deoxygenated blood sprayed out of the tube, splattering across Bridget's chest and neck. The pressure release was instantaneous. The kid on the floor suddenly arched his back and took a deep, shuddering, wet breath. The dusky blue in his lips began to recede, replaced by a terrible, fragile, pale pink. "I've got a radial pulse," Gomez shouted, his fingers pressed against the kid's wrist. "It's thread, but it's there." Bridget looked down at Hayes. The attending physician was hyperventilating his arms, trembling violently under his own weight, his hands completely submerged in blood. "Hold him," Bridget said, her voice dropping back to that gravelly, terrifying calm. "We're moving him, on my count." The trauma bay doors exploded open. Bridget and Gomez pushed the wheeled stretcher into the harsh, glaring lights of the ER. Hayes jogged alongside them, still keeping manual pressure on the femoral artery, his face a mask of profound shock. Diane was waiting. She didn't have her clipboard. She had the massive transfusion infuser primed and ready, the tubing snaking like translucent veins across the room. Ashley stood by the wall holding bags of O-negative blood, her hands shaking so badly the plastic bags rattled. "Lines," Bridget snapped as they locked the stretcher into place. The transition from the deafening chaos of the roof to the sterile, bright bureaucracy of the ER was jarring. But Bridget didn't miss a beat. She operated purely on muscle memory. "O-negative wide open," she ordered, hooking the chest tube up to the wall suction. The canister immediately began filling with dark fluid. Diane moved with a speed Bridget hadn't seen from the older nurse. She spiked the blood bags, locked them into the pressure infuser, and hit the power. The machine whined, forcing warm, life-saving blood into the kid's collapsed veins. "Let up Hayes," Bridget commanded, stepping up to the leg with a fresh, heavy-duty pneumatic tourniquet. Hayes stepped back. His arms fell to his sides. He looked down at his pristine white coat. It was ruined, painted in a dark, sticky rust. He looked at his hands, then turned and staggered out of the bay, leaning heavily against the glass door frame. Bridget applied the pneumatic cuff high and tight on the thigh, inflating it until it dug deep into the muscle. The bleeding stopped entirely. 10 minutes later, the doors to the ambulance bay slid open. The critical care transport team from Harborview Medical Center rushed in, rolling an isolette loaded with specialized monitors and an automated ventilator. The handover was a blur of medical shorthand. Bridget delivered the report with a cold, mechanical precision. Vitals, interventions, output, blood products given. She didn't stutter. She didn't look at the computer screen. She held the kid's entire medical status in her head. The Harborview surgeon, a gray-haired man with exhausted eyes, listened intently. When Bridget finished, he looked at the secure chest tube, the perfectly placed tourniquet, and the rising blood pressure on the monitor. "Good catch, nurse," the surgeon said softly. "You bought him a fighting chance. We'll take it from here." They transferred the kid to the transport rig. The doors hissed shut behind them. Then the ER was silent. It was a stunning, heavy quiet. The only sound was the low, rhythmic hum of the fluorescent lights and the quiet bubbling of the empty suction canister. Bridget stood in the center of the empty trauma bay. Her scrubs were soaked through, clinging coldly to her skin. She could smell the iron from the blood mixing with the sharp scent of the industrial floor wax. The adrenaline began to recede, leaving behind a cold, hollow vacuum. The military calls it the combat crash. It's the moment your body realizes you aren't going to die today, and all the suppressed terror and exhaustion flood back into your nervous system at once. Bridget walked heavily to the scrub sink in the corner of the bay. She stepped on the foot pedal. The water blasted out, scalding hot. She didn't care. She pumped the harsh pink chlorhexidine soap onto her hands and began to scrub. The water spiraling down the stainless steel drain turned a violent foamy pink, then a pale rust, and finally clear. She hated this. She hated the smell. She hated that she was good at it. She had taken this job at a quiet suburban hospital to stop having other people's blood under her fingernails. But the universe had a sick sense of humor. It always found her. A tremor started in her left hand. She gripped the edge of the metal sink, squeezing her eyes shut, trying to force her breathing to slow down. Breathe in for 4. Hold for 4. Out for 4. The grounding technique her VA therapist had taught her. It barely worked. The heavy glass door of the trauma bay slid open. Bridget opened her eyes but didn't turn around. She watched in the reflection of the stainless steel paper towel dispenser as Diane walked in. Diane wasn't holding a clipboard. She was holding a neatly folded set of scrubs, a pair of standard boring hospital blue pants, and one of her own cartoon character scrub tops. Diane set the clothes on the counter next to the sink. "I called environmental services," Diane said, her voice lacking its usual sharp, patronizing edge. It sounded thin, tired. "They're coming to decon the room." Bridget reached for a paper towel. The rough brown paper scraped against her raw knuckles. "Thanks." Diane lingered. She looked at the blood on the floor, the empty plastic bags of O negative on the counter, and then at Bridget's rigid, tense back. There was no grand apology, no dramatic realization, just a quiet, uncomfortable shift in gravity. The hierarchy of the ER had permanently fractured. Diane started, stopping to clear her throat. "We didn't know you were a SAR medic." "Hospital corpsman," Bridget corrected quietly, tossing the paper towel into the red biohazard bin. "And there's nothing to know. I'm just an ER nurse." Diane offered a small, hesitant nod that Bridget caught in the reflection. "Right. Well, take a break, Bridget. Dr. Hayes is in the break room. I think he's crying. I'll cover your patients." Diane quietly backed out of the room, letting the glass door slide shut. Bridget stripped off the heavy ruined scrubs and pulled on the clean clothes. The cartoon top was ridiculous, covered in smiling yellow minions, but it was dry, and it smelled of sterile laundry detergent instead of iron and jet fuel. She walked back out onto the main floor. The waiting room was still full of sprained ankles and vague coughs. The world hadn't stopped. She realized she hadn't charted the dilaudid she pulled for room 6 before the helicopter arrived. With a heavy sigh, she walked to the medication room and stepped up to the Pyxis machine. She pressed her scarred right thumb against the green glowing glass. "Access denied. Please try again." The soft, flat electronic chime mocked her in the quiet room. Bridget let out a short, hollow laugh that bordered on a sob. She let her forehead rest against the cold metal of the machine. She could pull a man back from the edge of the grave on the roof of a hospital in a windstorm, but she still couldn't open a glorified vending machine. She wiped her thumb on her absurd cartoon scrubs, took a deep breath, and pressed down again. Sometimes the quietest people in the room carry the loudest history. Bridget didn't need validation from the ER staff. She just needed to do her job when the sky literally fell. Have you ever been severely underestimated at work only to prove everyone wrong when it mattered most? Tell us your story in the comments below. If you loved Bridget's story, make sure to hit that like button, share this video, and subscribe for more deep dives into the unseen heroes around us.